one of the other things that we try to do is reach out to providers. I mean, I'm talking about physicians, and trying to understand more about some of the patients that they see and how we might potentially be able to get some infrastructure in place to help them. And one internist we talked to had shared a story about a patient that he had known for some years, and he told me that every 6 months he would see this patient, and they would show up in the parking lot. Sometimes they'd come into the waiting area, and he just knew that this patient was going to be at least an hour. And unfortunately, the way his practice was set up is he didn't have an hour. So he would, of course, try to stretch that, give it as much time as he could, try to stabilize the patient. This particular patient had a mental health condition among a number of other health challenges, and he was very frustrated because he knew that patient wasn't getting the care that they needed, but he didn't have the resources available to really provide it. And so I think what we were trying to go for as we started to put together things that we'll talk about in the next segment is we were trying to look for something that would provide more of an infrastructure for those kinds of patients, but also to support those kinds of providers that were really struggling in the current healthcare model to really address the core needs that were there.
If they're in the top 1%, we can assume that they're in the top 1% because they've been in the hospital a lot. I mean, they didn't get to the top 1% by being in and out of outpatient care or ambulatory care. So the 50% have a primary care provider. But in the healthcare perspective on that is, of course they should have a primary care physician. But I mean, Teresa, I want you to talk about this a little bit. That's not as easier said than done. I mean, there's a reason a lot of these patients don't have a primary care physician. It's not because they don't like doctors. It's access, it's socioeconomic, it's behavioral health. It's a sticky question, isn't it?
And the other component to that is that patients don't always understand the concept of a primary care provider.
Right.
That's a fairly new concept in terms of thinking about our health system trajectory. We've set up, as you mentioned earlier, we've set up diabetes clinics, we have cancer centers, we have heart failure centers of excellence, we have amazing resources for patients to go in and out of. Right. And we're fairly new at saying, and there's a hub in that spoke model, and that hub is your primary care provider. So our messaging and helping the public understand how to use the health system differently now is a really important component. There are lots of things that make it difficult for patients to succeed in being healthy. Right. And we often we at Intermountain are really good at looking at the physical health needs and the behavioral health needs. And we are learning how to look at all the things related to the social determinants of health. And that's a fairly new component for us to begin addressing. And so to hear that a patient has been assigned a primary care provider, that's actually pretty good news. There is at least a hub to go to. Right. It might be overwhelming once they get there, but there is a hub to go to. And that these patients who are in and out of the system, who have 12 attending physicians, I think the average Medicare right. patient has 7 different providers that they go to. So that's actually not overwhelmingly surprising, and it's informative to the amount of healthcare noise that's happening in their life, along with all of the other things that are happening in their life.